So depending on your other medical conditions, you may need to undergo medical clearance with your primary medical doctor, which might include blood work, an EKG, and a chest x-ray. And if you do have diabetes, you'll need to make sure that your blood sugars are under control prior to the day of surgery to optimize the outcomes for you. In regards to insurance coverage, our office will be sure to go over all of that and confirm authorization and insurance coverage prior to the day of surgery, so you won't have to worry about that on the day of surgery. Yes, you will need to arrange for transportation to and from the hospital, as it will be performed under general anesthesia and you'll not be able to drive right after the surgery. So prior to the procedure, you will receive a detailed list of instructions in terms of what you can and can't eat or drink and at what time prior to the procedure and what medications you need to stop. If you do take blood thinners, you would need to stop those within a specified time prior to the procedure, and the remainder of the instructions may depend on a patient-to-patient basis. You do not need to shave before the surgery. This is something we will perform the day of the surgery in the operating room. The anesthesia team or the hospital team will call you the day before the surgery to inform you at what time you need to stop eating or drinking before the surgery. You don't need to bring anything special with you to the preoperative area before the surgery. You should just have your list of medications. The day of the surgery, you'll arrive to the preoperative area and the front desk staff will check you in, and they need to place an IV and ask you multiple questions. You'll meet with the anesthesiologist as well as the pre-op nursing staff, and then you'll meet with me and we'll have to sign all of the consent forms and be able to proceed with the surgery. You'll also receive antibiotics in the preoperative holding area about an hour before the surgery to try to prevent infection. So it's very normal to have nerves before any surgery. I just recommend getting a good night's sleep. You know, it might not be a bad idea to have someone that you trust and care about to have with you the day of the surgery so that they can help with any nerves that you're having beforehand. And, you know, just try to do something to relax beforehand. You can always contact our office at Z Urology, and someone is always available from either our surgical team or our office manager to answer any questions that you might have before the surgery.